And this morning, Your Health Matters, we take a look at national cancer research taking place right here in northern Michigan.
Part of finding new ways to treat cancer patients involves constant research and going beyond what medical professionals already know. I worked with photojournalist Bob Rhodes to introduce you to one woman who took part in some of the research.
Life is good for Kathleen Hayes. She's a breast cancer survivor. But when she was diagnosed with the disease back in June 1995 at the age of 43, it was a much different story.
I had a mastectomy, then I did 9 months of chemo, and then a month of radiation. And after that, I went on 5 years of tamoxifen, which was standard follow-up treatment at the time.
After going through treatment, Hayes was eligible for a cancer study through Munson Medical Center. She ended up being a participant in 2 national clinical trials over a 10-year period.
So I was on the first study that was letrozole versus placebo. And that had such good results that they had to unblind it. So they didn't get all the study info that they wanted. So they asked people that were on the original study whether you would, re-up. And I said, yeah.
For Hayes, there's a simple reason why she chose to take part in the cancer research.
I feel like I'm alive because there are other people that participated in studies, and that's how we came up with the chemo regimes that we're using now. And so how could I not?
More importantly, she has a personal reason.
This summer I lost a friend who got diagnosed the same time I got diagnosed with breast cancer, and she's gone. I don't want that to happen to my nieces, to other young women. I don't want that to happen to women anywhere.
The study is looking...
Pam Bergman, the Munson Medical Center Cancer Research Coordinator, says there are currently about 80 different clinical trials at Munson open for a variety of different types of cancers.
Breast cancer, lung cancer, GI cancer are the ones that we see most frequently, and so we have a tendency to use more of those clinical trials. The majority of studies we do here are phase 3 studies. That may be a new treatment for a new type of chemotherapy or treatment for cancer. It may be a new combination of chemotherapy and radiation therapy.
For more than 30 years, Munson has been part of this national research with people like Hayes who volunteered to take part.
We are hoping that the person that benefits most directly from the clinical trial is the participant. But they also realize that we're going to gain valuable information for people who are treated in the future.
If we can cure this disease, if we can find a treatment that is going to be a much easier treatment that you got a pretty good chance that it's going to keep you cancer-free, I'm all for it. I've lost too many friends.
Now, last Tuesday when 7 and 4 News interviewed Kathleen Hayes, she actually reached a milestone of completing her very last clinical trial. So congratulations to Kathleen. And Munson will continue to follow her and other people who take part in the research for the rest of their lives, all to see if they experience any long-term side effects.
Great report there. Well, if you would like to take part in the research, we posted a link on our website, UpNorthLive.com.